Good afternoon, everybody. We're going to give it just a couple of seconds to let folks trickle in, and then we'll start off with some logistics reminders. Right, well, thank you, Nancy. So a couple of reminders, we're continuing to meet virtually, so you can join this discussion by smartphone, tablet, computer, or you could always use your telephone to dial in. Live captioning is available. To enable captions, please select the CC icon on your Zoom toolbar. And we also have American Sign Language interpretation. So we've got Jasmine on your screen right now. You should be able to see her. And we've got Anna who will kind of alternate throughout the webinar. The recording slides and transcripts will be posted to the California Health and Human Services Community Living webpage after the webinar. And you can also go there to find an archive of past meeting recordings, materials, transcripts. We are saving time for public comment, so please feel free. You can use the Q&A icon at any time to submit your comments, and certainly we'll be opening lines at the designated times. If you're joining us by phone, you can press *9 to join the queue, and we'll unmute your line to hear from you directly. And if you are joining us via webinar in Zoom, you can use that raise hand feature to join the queue. Right, and with that, I am going to pass it off to Director Susan Demaris.
Thank you, Maria, and good afternoon, everybody. Here we are, the middle of August, and 66 people are joining us. So thanks, everybody, for making time today for the Disability, Aging, and Community Living Advisory Committee. I want to give a very special thanks to my two co-chairs. One, Eric Harris is not with us today because he is on vacation, and I'm so happy about that. But Patty Prunehuber is here to lead us today, and welcome, Patty. To all the members of DACLAC, thank you for joining today and participating, especially our newest member, Debbie Tope, who I just saw in the chat is here. And to all of our department and agency colleagues who are joining us today, either listening in to learn or presenting. We have several presenters as well. And to our public members, thank you for joining in, and please do add your comments in the 2 times that we've set aside for public comment. And without further ado, we have a very packed agenda today, and I'm so grateful for that because everyone's been working hard since the last meeting to move the work forward, especially Sarah Steenhausen and Amanda Lawrence, who helped us build this agenda. So thank you, Sarah and Amanda. And now I want to turn it over to Undersecretary Marco Meach from the California Health and Human Services Agency. Marco's representing Secretary Galley today. And Marco, we're so grateful that you could be with us. Welcome to you.
Hi, Susan. I hope everyone can hear me okay. So first to the CDA team, thank you for all your work, and a special thanks to Patty and Eric for their commitment and dedication to this work in really helping us bring in all of you to help us think about how we much more meaningfully continue to engage with those with lived experience and others to make our programs and services much better. So I'm really excited to be back home. 7 years ago, I joined this agency, and the first assignment I had was to work with the Olmsted Advisory Committee at the time. And I'm really excited about the journey that I've had with this group and how much we've evolved together and what we've done. And so I'm just really happy to be back home with all of you and have a chance to connect with all of you today. I want to first start by saying thank you. I know that many of you have rolled up your sleeves and really helped us in really meaningful ways over the course of the last couple of years to help us think about how we deliver on the promise of some of our programs and services in a much more holistic way. And for that, I just want to say thank you, because we know you do this on a volunteer basis, but it has a profound impact in our ability to really be more person-centered. And so I just want to say thank you for your time and commitment to this work. We know that this isn't easy. I also send the Secretary's regrets. As you know, we are in the final stretch of the legislative session with a large chunk of bills in the HHS space. So he is very busy on that. And then we also obviously are continuing to respond to COVID-19, but have various monkeypox outbreaks across the state that he's working actively on. So he certainly sends his regrets and wanted me to express our deep thanks to each of you again for being part of this conversation. What I want to do is spend a little bit of time maybe walking you through, in my mind, how we puzzle together our various lanes of effort in service of those we look to serve, to give you just a little bit of a sense of how these things come together, because I think to many of you, these might be disparate efforts, but to me, and I think to the Secretary, they are pieces of a broader puzzle that build on top of each other, with the idea that we much more holistically serve the individuals that are coming in front of us across the various departments and offices within our organization. And as you've seen, we've also engaged a number of our sister agencies in this conversation, whether it's Business, Consumer Services and Housing, or Labor, or Transportation. Really, this isn't just an HHS issue, this is a whole of government issue. And so we're really looking to work together to break down the bureaucratic barriers, to be able to much more holistically deliver on the promise of our programs. But before I start, I do want to take a moment and acknowledge the fact that just in the last couple of weeks and months, we not only celebrated the anniversary of the historic Olmstead decision, which was the impetus for this group to convene, but we also celebrated the anniversary of a historic civil rights law that was passed, the Americans with Disabilities Act, which I think also is an important pillar of the work that you all do. And I think as I reflect back on the last 2 years, I think that although we've made a lot of progress, I think that much of this work is a constant work in progress. And so I think we will never get to a state of being fully at a place where we've achieved the promise of the Olmstead decision or the ADA, and that this is going to require us working together constantly to iterate on kind of the commitments we made as a society to individuals who are older and those who are disabled. And so I think that the Secretary has called on all of us to recommit ourselves to the promise of those two pillars, and I think we want to have you all do that as well as you think about your work and engagement with us. So I think it's important to acknowledge those pieces. But let me step back for a minute and just outline for you all and spend a little bit of time outlining for you kind of how I think about our work in a much more holistic way. And I am spending a lot of my time with my colleagues, both at the agency and with our directors, really thinking about how we break down the silos and integrate our work in a much more holistic way, with the idea that we serve the whole person in the community. And so to me, I think that there are a number of things that we've done over the course of the last couple of years that really build on this. And our budget alone has grown significantly to be able to really deliver on this vision. And I'm not going to go through each one of the budget items. If you have insomnia and want to go through the budget documents, you should do that. But I think that there are certain pillars or ideas in all of those that tie together really nicely. So for me, I think the foundational components are kind of three different buckets. One is our work around workforce. And I think this is probably more acute to all of you than anybody else, in the sense that we are seeing an older population. We are seeing individuals that certainly should and must really reside in the community. And in order to do that, we need to have the right people around them to be able to deliver on that wish. And so really thinking about what does the health and human services workforce of the future look like. This has been exacerbated by the COVID-19 pandemic on the health side, but we can't just think about this as just physicians and nurses. We have to think about this as social workers and IHSS workers, and we have to think about it as promotores or community health workers in the community. And so we've put forward a package with our colleagues at the labor agency of $1.5 billion to really think holistically about how we not only beef up the existing types of workers in the community, but how do we think about the workforce moving forward in more innovative ways as well? So workforce, to me, I think, was one pillar. The second pillar or foundational aspect is really our work around data and data exchange. And I think that traditionally we think about this from the perspective of health and your ability to go to a healthcare provider, and they may have an EHR or an EMR. These are electronic medical records, and their ability to really provide you holistic care, right? There might be a lab result or a prescription, and for the provider to be able to see all that in one place. But we're looking to take that a step further and break down the barriers around not only the integration of that data on the health side, but now beginning to think about this from a social services side as well, because what we know and what we've learned is that it's not just about giving someone access to health insurance and having them get access to a doctor. It's also about the food that they have on the table and the access to transportation and the roof over their head. And so we must think about the integration of these data elements much more holistically, so that those on the ground who are doing the work have a better understanding of who they're serving and what gaps they might be interacting with. And so really looking at kind of some historic work that we've undertaken to be able to deliver on the promise of data exchange in a much more holistic way. And then the third foundational aspect for me is infrastructure. And we are spending a lot of time, whether it's part of our work around CalAIM and the PATH funding, to be able to really build up the infrastructure at the community level to deliver on the idea of people living within the community, choosing where they want to reside. And so we've invested billions of dollars in both the behavioral health infrastructure, but we're also investing a lot of money in the community care infrastructure to really be able to lift up those facilities on the ground to be places that folks can reside. And so we're spending a lot of time and effort in kind of thinking about what that looks like, not just from the health side, but also from the social services side. So data exchange, workforce, and infrastructure, I see as kind of the bedrock. Those are the foundational pieces. Underneath all of that is kind of the idea of equity and inclusion. And so no matter what we do and no matter how we do it, we have to embed the lens of equity and inclusion in that conversation. And so we learned from our experience in COVID-19 that individuals with disabilities and individuals of different races were disproportionately impacted when it comes to the COVID-19 pandemic. And our work to get resources out to those communities was really anchored in this idea of leaning in on the data and being able to leverage the data to lift those individuals who are disproportionately impacted higher. And what I will say to you all here is that for us, equity and equality are two very different things. Equality means giving everyone the same amount, and equity means giving some folks more in order for them to be lifted higher because they're disadvantaged further. And so really thinking about equity in a much more holistic way, not as just an afterthought, but something that really is embedded in our work in a much more holistic way across our programs. And so those four elements build the foundation to create some pillars that we kind of think about. And those pillars really are focused around access. So making sure that people have access to health insurance and services in a variety of different ways. It's about affordability. We're looking at affordability from the perspective of making sure that middle income individuals have access to covered California, for example. We're also looking at some of our work around insulin to make sure that really we can have that not be a barrier so that people aren't making the decision around putting food on the table or making a decision around picking up the prescription of insulin. And then really thinking about some of our work around quality. And quality here for us is not just with respect to the health side, but really thinking about how do we lift up our providers in a much more holistic way on the ground. How do we give them the resources and the technical assistance to be able to raise their ability to deliver holistic services on the ground? And I'm really excited that you have the opportunity to think of or talk about CalAIM later, because CalAIM is one of those components, and certainly our reprocurement is another component on the Medicaid side, but we're also doing a lot of work around quality in other areas, whether it's our skilled nursing facility reform work, really looking at quality as a way for us to build up our ability to deliver services in the community. And all of this is kind of tied together with the idea that we integrate the health and human services components seamlessly in the background as we think about all of these pillars, with the idea that at the center of all of this work really is the person that we're trying to serve. And for us, it's about making sure that we're serving all individuals, people with visible and invisible disabilities, that we're thinking about all races and ethnicities and different genders or sexual orientation in a much more holistic way. And so I wanted to spend a little bit of time to just frame this for you, because I think that as we look to, talk about CalAIM, for example, today, CalAIM is one piece of a bigger puzzle around how we deliver on this vision. And CalAIM is tied to our work on home and community-based services. It's tied to our work around the master plan for aging. It's tied to our work at the Department of Rehabilitation to really integrate holistically people with disabilities into employment. So all of these pieces really come together in a much more holistic way to be able to deliver on what the Secretary and the Governor call a healthy California for all. So I just wanted to spend a little bit of time just kind of framing that for all of you, and really look to maybe engage for a few minutes, Susan and Patty, if that is okay with both of you, in a conversation, and I'm happy to take any questions that you have. What I will say as kind of a last point is that this is all a work in progress. And one of the things that that I will just emphasize with humility is that this isn't perfect, and it's not gonna meet everybody's needs. But we want to learn and we want to iterate on this work in a meaningful way. And so we welcome your feedback. We welcome your criticism. We want to have you help us think about how we do this in a much more thoughtful way. And I also want to just say that we want you to roll up your sleeves and really engage with us. Don't sit on the sidelines and just wait to be asked to engage. Really engage with us in a thoughtful and proactive and respectful way so that we can move the needle on these pillars in a much more holistic way. So with that, I will be quiet and I will turn it over to Patty and Susan. And I'm so glad Eric is getting some time off to just kind of get some feedback from folks and engage with all of you.
Terrific, Marco. Thank you so much for really taking us, off of our little computer screens and giving us the big picture of, the entire state of California and how this all works together. I will turn it over to Patty. We can take about 10 minutes, Patty, for questions, and I'll let you field those.
That sounds excellent. I'm looking in the Q&A box, but in the meantime, I want to thank Marco also for creating the large view that we need to jump into this work. And you will hear from us. You are hearing from us. I know you expect it, want it, and even when it's sometimes challenging. And I just want to call out one thing that you said, because I think it's really important in looking at how we deliver on both the ADA and its promise as a historic Civil Rights Act, and on the Olmstead decision that flowed from it that said that individuals with disabilities have the right to live in the most integrated setting possible. And that is really the the fundamental charge of this group and all the stakeholder input that we get. And so when we look at that, I think we want to look at all the healthcare services. And then you pointed out, and this is, of course, something near and dear to my heart, that you can't do home and community-based services or other integrated programs without a home, and understanding the importance of a roof over one's head. So thinking about that as a piece of healthcare that not only is housing health, it's what makes all other things possible.
And I just want to comment on that last piece just really quickly before we jump into questions. You know, there's two particular individuals, and I'm not seeing the boxes, so I don't know if they're here, but Michelle Boss and Kim Johnson, I think, epitomize the work in the space. And you know, I consider myself Michelle's older son because she has a Marco with a C and I'm a Marco with a K, and I'm her older kid. And I think that they've taught, Kim and Michelle have really taught me about this integration work. You know, Michelle, when she was at the agency, really pushed this from a foster youth perspective, and the two of them have partnered up in really profound ways. And I think it just demonstrates, I think, at the leadership level, how committed the two of them are to some of this work in a much more holistic way. And so I think it's reflective both in kind of how we looked at CalAIM, because I think that then you will probably hear, I'm hoping that Michelle and Kim are on or joining you later, but I think that that will kind of come through in the CalAIM conversation. And then when we think about some of the infrastructure investments, you know, the behavioral health infrastructure work and the continuum of care work, I think they've really looked to partner in a profound way to be able to leverage those resources across the way. And so I'm really excited about what the possibilities are with those two sheroes and the work that they do in terms of leading the department, because I think that we've got some tremendous leaders in the two of them. And I am more hopeful than ever before that the integration of health and human services or social services is going to be here because of those two. So I'm really excited, and I hope you get to hear from them a little bit later about some of this work, because I think that their teams are doing some tremendous work in this space.
Great. And now, because we are so fortunate to have you here, we're not going to let you off the hot seat until you get some questions. We're going to take Marty Yamoto first.
Hey, Marco, I think Jeannie, was Jeannie?
Oh, I couldn't tell the order in which they came in. I'll get to you, Jeannie, after Peter Mendoza.
Should I go or should I?
Yes.
Even though actually the last
Jump
one.
in there, Marty.
Hey, Marco, I didn't know that your mom was Kim, so actually, it's good to hear that. No, but I just want to, first of all, Marty Yamoto, CD-CAN, family member. I want to thank you for the way that you gave the overview. I know you've given it before, and I hope you know how important it is. And you know, way back when Dr. Gelly first came on board, and then you've been around, but the focus of looking at the whole person and crossing system lines, everything you said about the three pillars are so critical to everything that we're trying to do. So you know, we can throw money and programs, but if it's not done in the right way, all we're doing is doing things that we did before that didn't quite work. And I would just urge you to consistently put up that message that you just gave to us today, because for a lot of people that's new and it's hard to grasp. And all of us as advocates, we've heard it, but we still operate in silos, every one of us. And we just got to get out of that. And you being the messenger, and, you know, I put the guiding principles of the Health and Human Services Agency in every report I do. I thought that was so transforming. And one thing I would ask the committee, and Mark, you as the Undersecretary Marco, is the data exchange is so pivotal that I don't think a lot of people understand how pivotal it is. And the fact that you guys are focusing on that was amazing. So I would suggest that that's an agenda item, you know, coming up to where we are with that and why it's important. But thank you, Mark.
Thank you, Marty. And I think, you know, in government, we do a really poor job of communicating what we do. And so I think part of our task is, to your point, to be able to communicate how these pieces really come together. And I think that we have a lot more work to do in this space. And I know the secretary is meeting with the directors to kind of think about this in a different way. So if you have feedback or ideas, and everything we do, Marty, is anchored in the guiding principles and strategic priorities, and we will kind of iterate on those over time based on conditions changing on the ground and things that are happening. But I think it's really important to kind of think about what that looks like. And then on the data exchange, I often tell people that was almost like reaching a peace accord at the United Nations, because there were so many different players with different opinions and interests. And somehow we were able to land a really, what I think is historic and meaningful piece of legislation that is going to move the field in a profound way. And the scale and size of that work in California could be quite transformative if we do it right. So although we have a lot more work ahead of us, I would highly encourage this group to engage in a conversation on that. And I hope Susan and Patty, and when Eric gets back, that we can bring in John Ohanian and have kind of a work group session around where we go next with that work, because it's going to require some feedback and input from all of you around what that means and how we deliver on it.
Thanks so much. And I think we will want to have you come back and talk more deeply about the data exchange and understand how that intersectional data will be available, which is so important to look at to make sure we are centering equity. So we look forward to that. I'm going to turn it to Peter Mendoza, who has a question for you.
Hi, Peter.
Apologies. I think there was some confusion. I actually asked for I was asking a technical assistance question, which was answered.
Okay,
So
happy birthday, Peter.
thank you, everyone. I really appreciate it. I'm
Happy
56.
birthday.
Happy birthday.
It's
I
good
hope
Happy
to-
birthday, Peter.
I hope you party hard today.
Well, I'll party a little later, but in the meantime, it's good to celebrate my birthday with all of you. Community living is so important, and I am a testament to that. So I'm proud to be here at the age of 56, because I wasn't supposed to be here that long. So I'm beating the odds doing the work. So it's a good day.
Love it. It's great to see you, Peter, and thank you for all your continued work and help. You've been a great friend and partner.
Thank you, and thank all of you and the public for being here today.
Thank you, Peter. Jeannie, are you able to unmute your mic?
Sure. Thank you, Patty. This is Jeannie Parker Martin from Leading Age, California. It's great to see you, Marco, and thank you for your incredible inspirational words and the holistic approach in the pillars that you described. As I sat and listened and thought about all the people on this call, including the public who are on the call, I wondered if you have any thoughts on how the integration across departments of these important pillars is or might occur going forward. And maybe that's what you're looking for feedback from us, but I think it might be helpful for us to understand, even at an early stage, where you might be.
I think that's a fantastic question, and thank you for asking it. So I'm spending a lot of time kind of internally thinking about that, and I will outline a few different areas that I think are really important. So first, as Marty alluded to, the guiding principles and strategic priorities are designed to really galvanize us across the agency. It's not any one department on its own. It's all of us together and as an HHS family kind of rowing in the same direction. The second piece is we've issued guidance to all our departments and offices as we embark on the next budget and legislative cycle to really be thinking about some of those strategic priorities and how we move them across multiple silos of the organization. So we are very much interested in thinking about the next budget cycle, not only from the perspective of how we build on the investments that we already have, but how do we continue to break down the silos to think about investments that further some of this work? So a really good example, as I alluded earlier, is some of the work that DHCS and social services are doing around infrastructure. That is designed really to break down some of those silos. Third, we are beginning to create a set of tables internally that bring subject matter experts from across the organization, deep within the organization, on specific topics. So we're having a table around whole child, we're having a table on older and disabled individuals, we're having a table around homeless individuals, and there's a set of 6 tables that we're going to be convening with the idea that really we bring people together to create a community of practice, so that we're thinking about this not just from a DHS perspective of an aging perspective, but we're thinking about this from a person perspective, and all of those individuals are coming with all their programs to the table to think about how we move the needle on the integration component. So our hope really is that that is going to further some of our work. And then finally, we're really beginning to think about how we leverage our data to better understand the gaps, both from an equity perspective, but also from an integration perspective, so that we can begin to leverage that to help us move the needle on those gaps in a much more holistic way. And so what we're doing now is saying, you know, where are the gaps and what data do we have to identify the gaps? And in other instances, we may not be collecting the data, but maybe we should be, to better understand what is actually happening. And there's a twofold process there. There's one for us to better understand what's happening, but it's also for us to put it out so that you all can better understand how you're delivering services in a much more holistic way as well. And so our hope really is, by making some of these data assets available to folks, we have the ability for folks to see those gaps and fill them over time in a much more strategic way. So I think there's a greater opportunity always to think about how we do further integration, but those are some concrete examples that we're beginning to kind of implement across the organization to be able to really begin to see these things come together much more holistically. So I hope that answers your question.
Absolutely. And I think it compels all of us to look at the pillars and also use them to help integrate the work we all do, often collaboratively and sometimes, as Marco, or as was mentioned earlier, in silos. So it's really helpful. Thank you.
And I think one thing that I will just add, you know, the beauty of the process around the master plan is that we had the disability community on one end and the aging community on the other, and they never worked together. And this, for you all came so beautifully together in that process. And I think that it just kind of epitomizes how we need to work together to really move the needle in a much more intentional way. And so I would not think about this as about disease states or classifications of people, but really, like, irrespective, it's just about the human in front of us and really trying to figure out how we make government work better for them at both the state and the local level.
So Marco, there's a lot of interest. I'm gonna ask people to be brief because we are behind, but this is a really rich conversation. And I'm also gonna ask if you'd be willing to put your email in the chat so people could follow up with you. We're gonna take Nina and then Robert and Kim, and then we're gonna have to stop. Nina.
So good afternoon. I actually, lower myself again. I actually just have a really quick question. It's not this big vision question, but I think a lot of that has been filled in. Jeannie, your question was fabulous. Thank you. And this is really exciting work. My question was, and this could be an offline conversation, earlier you mentioned when talking about workforce, emphasizing workforce, thinking about it in more innovative ways. And so I would like some definition of what that means or some elucidation. It doesn't have to happen today, but at some time, so I understand and we understand what you're talking about. Also really appreciate the comments just generally about the aging and disability community having come together over the last 5 years, and also really speaking to Californians of all incomes, all locations, and making sure we're taking care of all of us. So my basic question is
on the workforce package. So the $1.5 billion has specific buckets, and we're looking at those buckets, but we're looking to also innovate in those buckets. And Nina, I'm happy to follow up, and I'll work with Susan and Patty to also, there's a document that we put together that outlines some of those, so you can take a look. We are very in the early stages of thinking this through, and we've got multiple departments working on this. So Kim Johnson is engaged from a social worker perspective. Susan is engaged from kind of the aging and disability perspective. Michelle and her team are working on, the community health worker piece. I mean, the DHCS and Medicaid led the way on this by creating a benefit on community health workers, and we're just blowing this up in a much more strategic way. And so HCI is kind of the anchor in the space, but I will just say this is the beginning of the conversation. So we would welcome your feedback around what we should be thinking about in those buckets and how we do it. And there's tables being set up by our departments to really engage stakeholders. But it would be important for us to get feedback from all of you as well, and Susan can follow up around kind of the workforce package and how we think about workforce moving forward.
Great. And if you, Marco, can communicate with the DACLAC committee, with myself or Susan about opportunities for engagement when those tables are happening, and around the HCBS settings rule, that would be excellent. We would really appreciate it.
Happy to do that.
Great. Robert, I don't want to miss a chance for you to ask your question or say something.
Thank you. Yeah, good afternoon to everybody. Marco, I'm Robert Mylan Taylor, one of your consumer advocates at DACLAC. Glad to see you. And I'm concerned about the insulin issue. Right now, type 2, 1, and 2 diabetes is very predominant here in California. And we have just found out that in the Senate, they only gave $35 to those who are Medicare to get insulin, which I congratulate. But unfortunately, plans like mine, like Partnership and others, will not have that advantage of definitely getting insulin at $35, which is capped. What the state is going to do for everybody to get insulin that is not on Medicare, because to prevent type 1 and type 2 diabetes, we need to have insulin that is affordable, and it can definitely reach everybody.
So Robert, thank you for raising that. And just to clarify, the United States Senate, not the California Senate, is looking at just passed the Inflation Reduction Package. As part of that package, they did approve for Medicare to begin negotiating on certain drugs. And there's only a subset of drugs that they are going to engage, and that's going to phase into more drugs over time. The $35 cap on out-of-pocket spending actually did not make it through the parliamentary procedures, from my understanding. And so that's still kind of out. And I think that to be determined on kind of where that ends up. In terms of what California is doing, let me just step back in terms of just the insulin piece. I think this is really important for us, and it's something that is of concern, particularly when we have a conversation about what I call the forgotten middle. So these are individuals who are not income eligible for Medicaid. They are on Medicare and they're teetering, right? They may at some point be on Medicaid, but they're not right now. And Michelle and her team are working on the Office of Medicare and Medicare Innovation Integration. I think that's going to be an important piece, and Anastasia Dotson is leading that. But the governor also has allocated money as part of our CalRx initiative for us in California to create our own insulin generic brand. And we are beginning conversations around how we do that, with the idea that we significantly cap dollars. So there's $100 million investment in the budget, $50 million for us to bring a biosimilar onto the market in California, and $50 million for us to produce it right here in California, with the idea that we drastically reduce the price of insulin in the state. And so our hope is that we're a model for the nation in order to be able to do that. While we do that, I think the ability for Medicare to negotiate is going to be a big deal. And I think that's going to help reduce the price over time. And our hope is that, that folks also lean in on the $35 cap, because I think that's an important component of this work.
Thank you, Marco, and my apologies, because I was thinking of the U.S. Senate when I should have said that. And thank you for letting us know about it. And please work directly with our CHS, Department of Social Services, whatever we can definitely do to definitely get insulin that can be affordable for those who have type 1 and type 2 diabetes, that they really need that cap for them to definitely get across the state.
Thank you, Robert. That's a really, really important issue to raise. And I want to make sure we have time for Kim.
Thank you, Patty. Marco, thank you so much for sharing the vision of the department. It's really exciting. My name is Kim Mills. I am a provider of the with the San Diego Regional Center. I provide supported living, independent living services down in San Diego. And I think about a person that we are supporting who goes across lots of different areas. And so being able to help her navigate these systems, she's involved in mental health services, child welfare services. She's currently homeless, in and out of hotels due to some mistakes she made along the way. And so she's our most challenging case as a single mother who's trying to raise her son, who's also being served through the regional center, and being able to in the future go across the aisles and access services to help her parent her son and help her with her mental health and her medical issues and all those things would be great. She recently got hospitalized because of some medical issues, and there was no options for her son except to go to the county receiving home, and which was sad, right? She has some issues that she has to take care of, but because she's been so unstable in her housing, she's not taking care of her health, and her son's not getting his health. So it's a frustrating case, and we're getting support from the San Diego Regional Center as much as they can. And so being able to open up doors to be able to access other services through other departments is exciting for me. So thank you for sharing the vision and what's to come. And so
I just, Kim, thank you for sharing the story, because I think this epitomizes where we're trying to get to, because in your story, I'm just going to name this person, Joanna, like she's having to go through 5 different doors to get services. And what should be happening is she needs to be going through one door. And in theory, that is a very easy thing to say. The directors on this call will say that's like really hard to do, right? But part of like what Michelle and her team are doing on CalAIM is to really deliver on the promise of that integration and whole person in one door idea.
Yes.
And what Susan and others are doing outside of the Medicaid program for the broader population, and what Nancy is doing around the regional center system in a much more holistic way to that vision. It's not going to happen overnight. We're going to have to push ourselves. But what we learned is that this is really hard work that takes persistence, and it's busting the status quo. People are very comfortable in their silos because it's the easy thing to do, but it's not the right thing to do. So I think that we have a lot more work to do, but your example is a perfect example of what Kim and Michelle and Susan and Nancy and Stephanie and others are trying to get to as part of our work across the agency.
Absolutely, and working with Nancy is a wonderful thing to do. I'm on a couple committees with her, and so it's great, but you can see the limitations. It's like their hands are tied, and there's only so much. And I'm always thinking, what about this? What about that? And so it gives me hope. Being in the field for over 17 years, it's nice to hear that things are going to get better, and people like the person that we're supporting will actually get the support that she needs.
I love it. Thanks for all that you do to support as well.
Thank you.
Well, Patty, I don't want to get in trouble. I think that was the last one. I'm sure you'll hear from our departments in a minute, and I'm so stoked that you get to hear from the awesome team at DHCS. Susan and others are just incredible. Susan Phillips, I think, is presenting a little bit later. So I'm very grateful to have the opportunity to be here, and thank you.
Thank you, Marco, and thank Secretary Gali for his leadership as well. Okay.
Thank you, Marco. And we will, those names that Marco just mentioned, I want to note that our directors are all joining us too. And this is just, one of many examples of their commitment. We have Michelle Boss, Kim Johnson, Nancy Bargeman, Stephanie are all with us today listening in, and have staff represented as well. So for our next topic, what we're going to do here with our agenda is we're going to make a slight, it would not be the DACLAC committee if we weren't behind already. So what we're going to do is we're going to actually take our break at 3:30. And so we're just going to adjust things by 10 minutes, and we're going to pick it up at 4:30 with our California for All Ages and Abilities item. So we want to be sure that Susan Phillip, who is joining us from the Department of Healthcare Services, has ample time to talk with us about PATH funding, an incredible opportunity that's in front of all of us, and to apprise the group of activities within CalAIM. This is a topic that this group the DACLAC has been following since we first met, and we are so appreciative that Susan can join us and we can have official representation from Department of Healthcare Services. Before introducing Susan, I also was remiss in acknowledging many of our legislative partners who are with us today, representing both the Assembly and the Senate, joining us today. So thank you for being with us as well. So Susan, please take it away. And thank you again so much for being with us.
Great. Thank you so much, Susan. And hoping everyone can hear me okay?
You sound great.
Okay, great. Thank you so much. Well, thank you all for having me. That was a great conversation, really energizing. My name is Susan Phillip. I'm Deputy Director for Healthcare Delivery Systems at the Department of Healthcare Services, which is, of course, our department that's administers the Medicaid program. And I'm here to really provide an overview of a newly launched initiative under CalAIM called PATH. And PATH stands for Providing Access and Transforming Health. So what I'm going to do is just lay out some of the key initiatives under PATH. I did want to spend a minute just reminding folks what PATH is intended to do in terms of CalAIM and our enhanced care management community supports benefits, and then really talk about how PATH is intended to support local capacity and really develop the capacity among our providers and our community-based organizations to really scale and support CalAIM initiatives and ultimately help our Medi-Cal members. So just really quickly, if we go to the next slide and the slide after that, thank you. So just a reminder, enhanced care management is a new Medi-Cal benefit under CalAIM that was really designed to help support individuals that have high complex needs. So complex care management for members who, you know, as we heard, do need to engage with many different delivery systems, need mental health care, need support for long-term services, primary care, specialty care, et cetera. So it's really providing that high touch, high needs set of care management services. And it also includes clinical and non-clinical needs. So it's really intended to coordinate that for members with really high needs. And, you know, this is really part of CalAIM's vision to ensure that we really are taking a look at our entire population, right, in Medi-Cal programs and saying, you know, are we really providing the set of care management services that everyone, in all settings and the full continuum of care that they really need. So just ECM is a pretty big initiative. We're really focused on specific populations of focus. We're taking a phased-in approach. We went live January 1 of 2022 for individuals who are high utilizers, individuals experiencing homelessness, and that was for those that were already in whole person care counties and health home counties. Those were previous pilot programs. So those folks were transitioned to CalAIM first. And then as of July, just a few weeks ago, we really scaled to the rest of the counties. A couple of things I just want to flag for you is as of January 2023, a population of focus that will go live are for individuals who are at risk for institutionalization, you know, living in the community, but might be at risk for institutionalization and eligible for long-term care. And then individuals that might be residing in nursing facilities, but can transition to the community. So that population of focus and ECM will go live January 2023. And then July of 2023, the remaining populations of focus will go live. And that is for our children and youth with complex conditions, foster kids, that will go live July of 2023. And then for individuals who are transitioning from incarceration, our justice involved population, so folks who are in transitioning out. So we can go to the next slide. Okay, and then just really quickly, community supports. These are 14 sets of services that are our managed care plans can offer. And I just want to highlight a couple of these services specifically. Again, these are services that managed care plans can offer, but they're not required to offer. However, we have seen quite a lot of take up among managed care plans for a number of these services. These ultimately, they're designed to address social drivers of health. And a couple of services, community support services I want to highlight are those relevant to recuperative care. So those are for individuals who might be leaving a hospital or and no longer need hospitalization, but do need some additional recuperative care services because maybe they're home or they're not living in stable housing, and so providing that recuperative care space will help enable them to have that that safe place to recuperate after a hospitalization. Respite services could be for caregivers, so for individuals who are really providing at-home services for a loved one, for a member. The respite services would be for caregivers. So a couple of community supports I just wanted to highlight, and these are have all gone live as of January, and then again taking in a phase-in approach as managed care plans begin to offer them statewide. So now getting into PATH, we'll go to the next slide. Okay, so as I mentioned, PATH stands for Providing Access and Transforming Health. So DHCS, we have received authorization for $1.44 billion, and the dollars are to be spent to really implement and scale enhanced care management and community supports under CalAIM. The idea is that, we know that there is a need in the state. We know that there are providers out there that could potentially provide these services, but they might not be ready right on day one. So how do we ensure that we are developing that capacity and making sure we're supporting that capacity building throughout the state? So the PATH funding dollars is really intended to go to community-based organizations, to providers, counties, local entities and organizations, also to tribal partners. We're really looking to ensure that we cast a wide net, and that organizations that raise their hand and say, we are interested in providing, say, a specific community supports or are interested in being an ECM provider can have that technical assistance and that capacity building support during these transition years. Our managed care plans are not eligible to receive funding under PATH. They have other dollars that are really intended to help incentivize and build capacity from the managed care side. Okay, so I'm going to get into each of the different initiatives. So there's a lot of information here, so I'll be speaking fast and hopefully we'll have some time for questions at the end. So just, I want to just really focus on the 3 initiatives that have the star next to it there. So first, I wanted to talk about collaborative planning and implementation initiative. These are dollars that are really intended to support planning and implementation, as it sounds like. So, at a regional level or at a county-wide level, organizations including providers, community-based organizations, counties, public hospitals, and the managed care plans coming together to say, okay, what are the gaps in our community and what do we need to do to really promote readiness for enhanced care management and community supports. So these are specific dollars intended to support the planning efforts. The next initiative is called Capacity and Infrastructure, Transition, Expansion, and Development. So CITED is the acronym for that. And so these dollars are really intended to support that transition and expansion and development of capacity for, again, for providers, community-based organizations, agencies. The idea is these dollars are really supposed to be tangible dollars to be given for specific efforts, like, if or CBO needs help with their billing system, or if they need the technical assistance, specifically as it relates to getting that technical infrastructure, these dollars will be intended for that. And then finally, there's a technical assistance marketplace initiative. And the idea here is, we know that, again, there's lots of organizations that might want to participate, but really don't know how to, say, for example, engage with a managed care plan, or how to kind of do that strategic planning. Or they don't have that capacity as of yet. So the technical assistance marketplace, the idea is to really have vendors that could partner with organizations that need that help. So our intent is to set up that marketplace and have that go live January of 2023. And I'll go into each of these in a little bit more detail. We can go to the next slide. Okay, so this provides a timeline for our PATH initiatives. We are really in the midst of having this go live. So collaborative planning and implementation initiative, we have launched that. And so what we are doing right now is working to identify facilitators in the counties and regional facilitators that can help, again, bring organizations together and ensure that that planning effort is underway. So we are presently working to identify and interview potential facilitators. And then on our website, we will have registration open. The Cited initiative has also launched. We actually just went live as of August 1st. So this is all very new. So I'm really glad to be here to help spread the word and hoping you all will help spread the word as well. And we'll definitely have information. I'll share these slides. I saw some notes here. Yeah, definitely we'll share these slides, and we'll also ensure that you know exactly where to find the applications. So there's at the end of this presentation, there's links to all the to where to find the applications. So Cited Initiative has launched, and we are intending to have an application window period between now and the end of September, and then with funds being dispersed by the end of this year. The TA Marketplace, as I mentioned, that is one that will require, kind of a bigger lift for us to identify the different TA vendors and to bring them on board, and then to set up a website that will show, who here are the vetted TA vendors that organizations that are interested in technical assistance can partner with. So that website and the marketplace will go live January of 2023. So we can go to the next slide. So for a number of these initiatives, DHCS, we need a third-party administrator because, as I mentioned, these are pretty big lifts. So we did hire and onboard a third-party administrator called Public Consulting Group. They have quite a lot of experience in working with other states and being a fiscal intermediary and working to provide develop applications, vet applications, provide grants. So they just started as a beginning of July 1st is when they started. So they've really hit the ground running. And they've set up specific website for us where a lot of the application and those processes are currently being launched. And the Cited one has gone live. So we can go to the next slide on collaborative planning. So I just want to just dig into these three a little bit more, and then I think we can break for questions. So as I mentioned, so collaborative planning. So we're working with our third-party administrator to, again, identify the facilitators for the collaborating planning effort. The idea is that each PATH facilitator in each county or region will have funding, and the planning efforts really are to build off the existing collaborative planning efforts. So for example, under other initiatives called the Incentive Payment Program, we know that there's health plan, managed care plans and organizations in the community that they partner with already have done work to develop gap filling plans. So we want to make sure that any efforts that are currently underway, that the collaborative planning effort really takes that into account. We're also looking to make sure that there's real clear milestones, the dollars are to be used to ensure that the meetings actually happen, that they're really bringing everyone to the table. We really want the facilitators to be neutral and ensure that, that there is that collaboration in the county and there's good representation. We really, as Marco alluded to earlier, for all of these initiatives, we are looking at everything through an equity and inclusion lens. So one of the things that we charge our TPA to do is ensure that we're looking at our application to ensure that there's equitable distribution of funds and that we really are looking to ensure that we'll bring as many folks to the table, and that organizations that have good representation are engaged throughout the process. So the next initiative is cited, and this is an application-based process. So the application will have to meet minimum eligibility criteria. So, first, an organization just needs to fill out an application. So that's the first thing. And then the funding request needs to be reasonable and, and attest that the funding will only be used for permitted uses. So, and I'll get into a little bit more detail of what we mean by permitted uses. So there's also a requirement that there can't be duplication of funding, so that should be avoided. But we are looking to ensure that the funding is really used again to develop capacity. So the dollars can be used, for example, for hiring, for looking to increase the provider workforce. It could be used for billing and referral systems. It could be used for IT systems, as long as there is a tie to CalAIM and to deliver ECM and community supports. The other point I did want to mention is that these funds may be used for retroactively to as only till January 1, 2022, which is when we received the authority to spend. So, if there are projects underway and that there is a clear tie to investments that the organization has made, that is a permitted use of funds, we are permitting to, have the application reflect that, and the retroactive funding request is permitted, and it will be subject to some guardrails and requirements. So for the application windows, I did want to just show this just to indicate that, what we're trying to do here is have kind of big application windows, a 2-month period. What we will be doing is ensuring that there's multiple application windows throughout the process. And the idea is, we know that, organizations that might really need the funds, but might not be able to kind of raise their hands and fill out the application on day one, they can then do it at a later application window. We do know that more sophisticated organizations that might already have some capacity will be able to fill out the application, but we want to make sure that the dollars are really going to those organizations that need the capacity building. So we have multiple application windows throughout the process. Okay, we can go to the next slide. So then finally, we do have the technical assistance marketplace. And, again, the notion here is that entities that need the technical assistance can apply for that hands-on technical assistance support from vendors, for example, for off-the-shelf TA resources. The third-party administrator that we have onboarded, PCG, will contract with the technical assistance vendors. So we're going through a process right now where we're taking a look at potential vendors. They will be vetted, there will be contracts with them, and then they will be those approved vendors that will be participating in the marketplace. And the sorts of services that they might provide are, say, for example, guidance for data sharing processes. How do I set up a robust data exchange process? How do I, contract with a managed care plan? How do I ensure that, I'm thinking strategically over the long term on how to build capacity for my enhanced care managers? So there's a number of technical assistance services that will be available through the TA marketplace. We can go to the next slide. So this is giving you a little snapshot of the different domains, if you will, of the TA marketplace. So we envision, having multiple domains. You click on one, and then you see the vendors that we vetted that would be providing those types of services under each domain. As I mentioned, it's a range of services that, depending on where you sit and what your current capacity is, these are the domains that could be offered through the TA marketplace. We're, really interested in hearing from you all if there are other technical assistance domains or, other things that you're hearing that you think we really ought to ensure is reflected, especially in terms of TA needs that, we need to try to support through the TA marketplace. So, so I think that, you know, just in the interest of time, I think that really wraps up the meat of the presentation, and we'll definitely make sure that the presentation is available for everyone. Just really quickly on the very last slide, if we can get to that. Yep, here we have links that we can make sure that you all have available. The one I want to point out specifically is a PATH cited round 1 application is live now, accepting applications through the end of September. So please do help us get the word out there. So with that, I will pause.
Thank you so much, Susan. That's such a rich and one might say dense amount of information. So thank you for sharing the slides. I know you're on a tight time frame and we are running a little behind, but I want to make sure there's an opportunity for a few people perhaps who haven't asked questions at the last Q&A, if they have questions for Susan about the PATH program, about how community-based organizations can access this, what kinds of CBOs you're seeing come to the fore to make sure that we are reaching into communities that might be underserved. Let's see, Michael, I see you have a question. Michael, can you unmute? I think we lost.
Patty, it looks like Michael may have stepped away, so maybe we can
I see that.
back
Okay.
around.
Let's go to, I'm just seeing whose hand is up. I'm going to take, I know, Peter, you asked a question before, but I don't see another question. So why don't you go ahead, okay? You're still muted, Peter.
Sorry, I know how to work technology by now. This is a great presentation and will be helpful to so many community members. I'm just wondering, are you reaching out to regional centers, for example? Have you talked to the Association of Regional Center Agencies, independent living centers, and ADRCs, which are Aging and Disability Resource Connections? How does this fit in a one-door system? I know that's a lot.
No, that's a great question, Peter. That is definitely on our target list. You know, this is all, you know, we're getting this all launched. And so actually we're looking for folks that we need to be reaching out to, but that they are, the Association of Regional Centers is on our list. And yeah, we definitely welcome any suggestions for organizations we need to outreach to, especially those that can help us further reach out to additional organizations. So thank you for that.
Great. Lydia, I see your hand is up.
Yeah, hi, Susan. Thank you for that. A quick question, and it follows up on Peter's. For the local conveners, was I to understand they're already gathering community members together? And if so, I was wondering if you're aware of how they're doing their outreach. So it's sort of a similar question to Peter's, is how, I don't know that, for example, in our community, people are aware of this convening. So I want to be sure they are.
Yeah, so they haven't started the convening yet.
Okay.
What we have done is really just getting started on identifying who they might be, like who are the potential facilitators. We're in the process of vetting them now. We're actually looking across the state and assessing, you know, are there areas where we need conveners? If there aren't any. So, you know, we're really also open to suggestions. If there's, you know, areas and organizations that you think would be great neutral conveners, we're also very open to that. So please do suggest. Thank you.
Thank you. Jeff, do you have a question?
Yeah, actually more of a request than a question. Great, very informative presentation. Thank you very much. For some of us, it's a little hard to say the material, the links from the chat. So it would be helpful Patty or someone to send out the link so that we could keep it and pass it on to other folks who I know would like to see it.
Thank you for that. And I know it's always an access issue that we should be aware of and doing in every DACLAC meeting. So we'll thank you for that reminder.
Thanks.
Susan, can I ask you a question? I'm curious, I see this suite of services that managed care homes are going to be able to offer. And as you point out, many of them are voluntarily choosing to offer most, if not all of them. What happens when an individual wants a service? Is there any way in which they can, for example, say that they need a particular service, and if the managed care organization denies that they have a way to grieve that or appeal that to get that service, whether it's respite care or some security deposit or some other enhanced care management?
Yeah, so the enhanced care management benefit is statewide. All plans are required to provide that. So that is, you know, the care coordination. So helping to identify that those services are needed is a responsibility of the ECM provider and the managed care plan to ensure that that is done. So, you know, if there are, first of all, I will say that ECM and community supports providers are to be listed in the managed care plans provider directory. You know, there is sometimes a lag and sometimes it's not complete, but that is the requirement. And, you know, they are pushing we're pushing to ensure that those are as complete as possible, especially during the first couple of years of implementation. So we are reviewing those. And then in terms of member complaints and grievances, there's always for any Medi-Cal covered benefit, of course, members may grieve and or complain if there are, you know, services that are potentially denied. But the managed care plans are, you know, even if there's something that they're not offering, they are to work with the ECM providers to help the member find those resources in the community. So even for non-covered benefits, there is a requirement that the ECM provider help to provide to locate those services within the community and connect them. So the referral, even for non-covered benefits, is a requirement.
Thank you. Are there other questions? I see Nina put a question in the chat. Let's see if we can find that. Is it in the chat or the Q&A, or Nina, do you just want to come on?
Yeah, I'll just say, and I was munching, so my camera was off. So my question was really about, so the ECM, they don't all have to be offered across all counties. And by the way, this looks like a great pathway to training community healthcare providers. But I guess my question is, we'll have to answer this today, will we ever see a time where the services will be mandated and uniform? So in other words, counties may deliver them in different ways. I mean, we see this because the state's still highly fragmented. You go to one county, you get this, another county, you get that. Is there any way you can answer that?
I mean, it's a great question and great observation. It's true, there is variation throughout the state. I will also just clarify again that enhanced care management is statewide and is required to be provided statewide. It's a community support, so it's that 14 set of services where there is variation across. So we have are working with to understand where there is variation. So for example, you know, we know in certain counties, you know, the providers are working to provide certain types of community support services that might be really time sensitive, you know, so after a hospitalization, ensure that there's, you know, a quick authorization of those services. So has been some variation. And so we've been providing guidance and now enforcing that to say, okay, you must authorize these services within 72 hours. It doesn't make sense for it to be languishing for, you know, an authorization to be languishing for, you know, days and days, especially when it's time sensitive. Same with, you know, medically tailored meals, especially if it's post-hospitalization, those need to be authorized quickly because the whole point is it's to be done right after a hospitalization, right? So, so where there is variation and we can provide guidance to standardize that, we're trying to understand and hearing from you all of where there is variation and understanding that is also helpful. So we're always open to hearing feedback and especially during this implementation phase.
Thank you, Susan, for this very informative sort of new launch. We really look forward to a successful implementation and a lot of community and stakeholder input. I'm gonna let you go because I know you're on the clock and turn it over to Lydia from the Alliance for Leadership and Education to talk about the CalAIM work group update.
Great, thanks, Patty. And I know we're a little behind schedule, so I'm glad I put some slides together. I didn't make them fancy, but the content in there is something that can be viewed later for a little bit more information on what we've been up to. So first, I just want to say thank you to all of you for this opportunity to join forces with a collaborative for California Collaborative for Long-Term Services and Supports. Since there's a great deal of overlap between this committee and that work group, it made perfect sense. So we did have a meeting on the 24th, had representatives from Department of Healthcare Services and their consultant, Manat. And I have to say, as sort of an overarching comment, I think it ties in really well with what we've heard already from Marco and Susan and others, that it has been terribly refreshing to have meetings, not among ourselves. We know each other, we've worked together a long time, but with the department and their consultants, and really feel like there's engagement, there's some deep listening, and there's a reflection back when we see updated guidances as this one, which I hope you will all take a peek at your leisure, the Enhanced Care Management Policy Guide, that shows folks have been listening. So I wanted to first start with that. Thank you to the DHCS team and Manat, Susan, and your team for really listening to the community and the feedback from lived experiences that many people have shared, and from systems issues that some of us care deeply about. So let's go ahead to the next slide. And this piggybacks on what Susan was just talking about, and Marco, data exchange and sort of global population health goals that want to be reflected in these guidances. And I think they are. And you can see from listening to Susan that the PATH funds are a way for all of us to engage our communities in CalAIM in a way that has never happened before with initiatives I've been a part of for now 30 plus years. There's actually funding to help communities get ready if they're not yet, or if they are ready and just need a little bit of help to really become part of this incredibly complex and important initiative called CalAIM. So, you know, we do have some questions, especially my CBAS community, because we have been part of managed care for so many years now, as to, you know, how our plans investing in improving systems. I have to tell you guys, the infrastructure at the health plan level varies widely. There's still a lot of faxing going on. Some health plans have just recently created uploads where providers can upload data directly to their computers, but there is no data exchange going on today. So it's a vision and goal we all support on the LTSS work group, and I believe this group as well. So we really want to continue to push that. We should be monitoring. We will hear more about that, it sounds like, at a future meeting. So next slide there. I am really thrilled, and the CCLTSS committee and those of you who were engaged from this committee as we had this look at the May revision of the policy guide, really thrilled to see that, again, DHCS listened deeply. And this definition, I think you will agree if you have a minute to study it, really captures what we need to identify those people who are the most complex in terms of their needs, their biological, their medical needs, their psychological needs, their social needs, to be as inclusive as we can. And I'm also very proud that I can see a great deal of reflection in this definition from our experience with the Community-Based Health Home Project and also the CBAS MSSP definitions that are used today for eligibility. So we're very pleased with this. It focuses on function and not medical criteria. So my editorial comment, we've come a long way, baby, over these last few decades. Next slide, please. Network development is going on now. I can tell you all that, and I was happy to hear Marco and Susan reflecting that this is going to be an iterative process and ongoing. So all of you, again, if you're not familiar with CalAIM and you represent or you are a community provider and feel you can contribute, please do get more familiar. It is a big, complex system change, but it's an incredible opportunity, and it's incumbent on us in this committee and the CCLTSS to help now and to provide some oversight and feedback, as Marco and Susan both invited us to do. As this rolls out, there's going to be, believe me, lots of bumps along the way. And who better than to provide that feedback, but those of us who care deeply about this and are connected to our communities in so many ways. So these are some of the questions, we've been asking. Some of them are addressed in the guidance, so we were happy to see that. Community services, yes, is not required statewide, and each plan can pick and choose. There is a huge grid that one can view to show what each health plan has selected for their community services menu, if you will. So if any of you are interested in that, I'm sure we can get you that link so you can see that directly if you're wanting to understand what's going to be available in your community for this next rollout of population number 5, which is writ large going to be a lot of dual eligibles being able to engage in enhanced care management and community services. What does network adequacy look like? I don't think that is really clear yet. We know because this community of long-term services and supports has been so under-resourced for so many decades that there are going to be huge gaps in certain parts of the state especially. So what is being done about that? Path funding is one approach for getting some access improvements, but we have areas where I think there's literally going to have to be some building from the ground up of services to make them available to everyone. So next slide. So we'll be keeping an eye on that. How will people be identified? So the May 2022 guidance clarified this a little bit more. Our group that discussed this really believes that the biggest way that people will be identified is referrals from the community. The risk stratification, it's called, that the health plans will be engaged in, sort of, ranking people by criteria that show how complex or at risk they are, is not going to capture all of those social determinants and the other factors that put people at risk, as we've talked about today. So we really believe that the referrals are going to be from the community, and we need the community to understand what that process is, how they can make referrals, what happens when they make a referral, some feedback loop. Did that person actually get connected? Have they been assigned a care manager? And so on. So I think this is an area we all need to pay really close attention to, everybody, and continue to provide feedback. We've been invited to do that. Next slide. We've also learned through our discussions that there will be a standardized tool that all the plans will use. It's currently in effect, and there are some common assessment questions having to do with long-term services and supports. But beyond that, in terms of designing a care plan and further screenings or assessments that may be needed at the plan level, or if the plan is delegating to a physician group at that level, it isn't clear yet how much standardization there will be. So this is another area I think we need to dig into a little bit more. When someone is found to be eligible, then how do we figure out with that person at the center and communicate with them about what their needs are. So we also have talked a little bit about accountability, especially for people that are already receiving multiple services in the community or might have gaps where new services are going to be offered. Who's accountable for that care plan and to make sure that the person truly is connected and has transportation and all of those things that you all know are so important when one's living in the community and trying to access multiple services. So I think this is another area that we can talk about a little bit more. Yes. Just a couple more ideas here to share. We'll wrap up. Oh, sorry. Yes, meeting slide. Next slide, please. Just have a couple more. Coordination is going to be another area I think that we all need to pay a lot of attention to, and what are going to be the reporting requirements so that we can understand what does success look like in terms of eligibility, care planning, referrals, and then the coordination. So we need to also pay close attention to that as it rolls out. Next slide. And we've talked quite a bit about providing ongoing feedback and improvement. And is there a way to formalize that a little bit more? Can there be a rapid response team, for example, at DHCS? So when we see systems issues emerging, as we did early on in CCI, you know, is there a way to identify those quickly to the right people and talk about solutions and make course corrections along the way? Okay, next slide. I think this is about it. The other things we've talked about in these discussions at CCLTSS is making sure member notices as they go out are clear and understandable, using plain languages, etc. Making sure we have the technical assistance I just mentioned. How are we educating physicians? That was a huge barrier during the rollout of CCI, a lack of awareness among the physician communities and others. And contracting and payment problems. PATH sounds like there could be some technical assistance provided through that, but I don't know if it'll be in place by January. And then sufficiency of rates to attract people. So that's kind of a high level overview of multitude of things that we've discussed and provided feedback to DHCS about. And I appreciate the time to give you that overview. And I think we're at time right now.
Thank you so much, Lydia.
You're welcome.
There's a lot here. If people want to get involved, if any of the stakeholders or members of the public want to get involved, can you put in the chat how they might do that? And this is a really great presentation. Thank you so much. And also, if you're willing to share your slides, I think we could put those up on the DACLAC site where we provide materials, because there's a lot of helpful information here.
Yes, that was my intention. So thank you, Patty. Yes,
thank you, Lydia. And we're gonna, everyone's been very patient. We're gonna take a break now. If I'm not mistaken, it's a 10-minute break, and we will be back at 3:38. See you soon.
Patty, would you like me to start things up again here?
Yes,
We'll go
please.
ahead.
Yes.
Okay.
And I think that we're ready now for public comment.
Excellent. Great. So we did allow 10 minutes at the middle of our agenda for public comment, and we will also have at the close of the meeting additional time for public comment. On your screen, you will see the instructions for anyone who would like to make a public comment. Maria, do you want to walk through the instructions?
Sounds great, Susan. I'm happy to do that. Let me get myself on camera and up and going. Okay, so thank you, everybody. Public comment is open. So if you are joining us by Zoom, you can use the Q&A function, or you can use that raise hand icon, and that will add you to the queue for questions and comments. And attendees joining by phone can press *9 on your dial pad, and that will add you to the queue. I just want to flag that there have been some questions that were submitted in Q&A, and it looks like folks have been responding on a rolling basis. So I encourage you to check that out. And we'll give it a couple more seconds to see if there are any guests joining the meeting today who want to jump in. Okay. Seeing none, I'm going to pass it back to Susan.
And I will pass it to Patty, and we're going to move into the second half of our agenda. Thank you, Maria, where we'll now hear from our housing subcommittee. So Patty, would you like to lead this?
I'm going to pass it to Marty. So we're passing. I will be back on, but Marty's going to sort of set the stage for us. So take it away, Marty.
Thank you. My name is Marty Yamoto. I'm a family member, CDCAN, California Disability Senior Community Action Network. And first of all, just thanks to the California Department of Aging, CDA's fantastic team, Susan, and everybody in the interpreters, everybody who is, did the logistics for this meeting. Yeah, I mean, it's top notch. It's very valued, and it helps make the information much more accessible. So thank you to that. Let's go to this. I don't know if my slides are up. We're going to make this really brief, given the time. I just want to remind everybody, as we're talking about housing and all these major initiatives, and it's going back to what Marco actually spoke of at the beginning, which I thought was really important because it's very foundational for all the changes we want to make to really transform what happens in people's lives. But ultimately, everything we do, whether it's housing, transportation, health, supports in the community, it's about people. And it's got to be ultimately that it has to make a difference in someone's life. And so when we talk about the Olmstead decision, often what gets lost in that is that it was about two individuals. I mean, it impacted millions of people across this country, but the lawsuit was filed by two individuals, Lois Curtis and Elaine Wilson. Elaine's wearing the red or pink dress there. I had the honor and privilege of introducing and helping Lois Curtis speak to an audience of 1,500 people in front of the state capitol many years ago. And also had the honor of actually getting to know Elaine Wilson by phone, actually, in those days before she passed away. But I want us to remember that the Olmstead decision and all the rights that came from that came from the Americans with Disabilities Act, were about people. And in this case, it was Lois Curtis and Elaine Wilson. Olmstead, by the way, was named after, the lawsuit was named after the then head of the state of Georgia Health and Human Services Agency, Tommy Olmstead. So next slide. And why I got involved, like many of us, is for personal reasons that inspired us. The black and white pictures, my older sister, Elaine, she had developmental disabilities, physical disabilities, mental health needs. And she lived into her 50s. And all through her life, there was always issues of getting access to the right health care, to the right supports, and later years, housing. And then the other picture is my younger sister, Sherry, who had health problems with her heart and could not access insurance because of the cost. Both died within 2 years of each other, 2003, 2004. And so they've inspired me to continue working to make sure that kinds of things don't happen to other people in the future. Next slide. And right now I'm extended family, unpaid caregiver to a young man. This is 16 years ago, named Alex Brown, who has Down syndrome. He's on the autism spectrum. His mom, who's pictured to the right, passed away and died. They had no family. I've known him since he was 7 years old. He would have been placed in the group home, basically, or some other setting that was not one that he wanted to be in. And so I took him in. But that's a good example, though, where housing is so fundamental, to a person, but it has to link into what that person needs and wants. Next slide. And as we talk about housing, as we talk about transportation, as we talk about healthcare or behavioral health and all these other issues, it is ultimately about justice. It's about people. And back, many years ago in 1969, the families who came up to Sacramento to fight for the rights of people with developmental disabilities, but really were about the rights of all people with disabilities and even older Californians. And those families told the legislature, we are here to speak for justice. And so I think we can't forget that what we talk about is not just a thing like a house or a car or a bus or healthcare in a hospital. It's about justice. Next slide. And I'm showing these pictures, next slide, to just remind us that whatever we talk about, again, it's about human beings, people who are desperate for all these things that we are talking about. And ultimately, we have a responsibility as advocates, as we sit here in our various places throughout the state in this meeting, to make sure that we do that whatever we do in terms of our work, it makes a difference in the lives of people that these pictures represent. Next slide. And again, these are more pictures of people that we need to make a difference for in everything that Marco was talking about. Next slide. And next slide. And I know this is kind of small for you to read, but I wanted to make sure that everyone knew on this committee and also the public who are members of this subcommittee. We have met several times since I think February, and we plan several more meetings every month to really take a deeper dive on a lot of issues of housing. Some of it will actually, next slide. Some of these issues will be issues such as supportive housing, CalAIM, additional CalAIM supports regarding rental assistance, SSI reimbursement rates. I won't go into the detail here because of the time. Next slide. Other issues like applying the AB 1482 2019 Tenant Protection Act cap on rent increases to low-income housing tax credit properties and mobile home land rents. That defining what the housing need is based on a whole person planning concept and also linking that to outcomes, not only with the Department of Developmental Services, but also other key state agencies, Department of Healthcare Services and Department of Social Services, Department of Aging. One of the issues that some of the advocates raised in the subcommittee is we don't even know the dimensions of the housing need that older Californians and people with disabilities face. In other words, what are the numbers of people who face crisis, imminent crisis of losing their home? How many people are actually homeless, but actually are not on the street, as one of our subcommittee members actually is experiencing? She is homeless with her family, but is not on the street. And so where does she fall in terms of the reporting? Also, and goes back to a point made by one of the subcommittee members and also a member of our committee, Nina, who's always has pushed that we remember those who don't qualify for Medicare or other low-income programs, and so that the subcommittee will look at how do we find solutions to help older Californians and people with disabilities who may not qualify for low-income housing assistance programs due to their income. Next slide. And again, going back to ultimately what we came up with the priority in terms of recommending to this committee to focus in on the September 12th event, the Day of Action. California was the California Abilities for all ages and abilities Day of Action. And we were focusing on one priority, or decided to focus on one priority, and Patty will speak to that. And the reason we focused on one priority is because this particular, next slide, this particular priority crossed all the different disability groups, was important to people who are older Californians, crossed all departments. And it's something the state of California has not done, but actually would make a difference in people's lives if it was done. And that's targeted rental assistance for older Californians and adults with disabilities, including developmental, and also tying it to also low-income renters at imminent risk of homelessness, and also those who are homeless. I do want to, first of all, before we turn it over to Patty to, take a little bit deeper dive on this priority that we want to recommend to the committee. And again, this is a priority for that September 20th event, but I want to open it up to allow the subcommittee members to weigh in on this particular priority, and also on other points you want to make. Just be conscious of the time. And actually, I don't know how we're going to do this because I don't have control of who can speak, though often I wish I could.
Marty, that was brilliant. I just want to thank you for making it personal, making it inspirational, and also reminding us that there's work to be done. So perfect, just perfect. I will, if I can share my screen, which means if you can stop sharing your screen, we will very quickly describe the targeted rental assistance program. And as Marty said, what we're really trying to do here is when we go to the September 20th Day of Action, and it is the 20th, we want to come in with some very concrete recommendations, and we want to prioritize those that are really critical to moving DACLAC's goals and vision along of integrated community living for everyone who can embrace that if they have the services that they need. Okay, so now I'm going to try to share my screen. This is, I know, not going to be a surprise to you, but unaffordable rents are driving homelessness. We know that, and we know that about 8 out of 10 extremely low income renters, which is not as low as you might think. In California, that's about $26,000 a year, pay more than half of their income for rent and utilities. And older adults and people with disabilities who live on fixed incomes are being priced out of the rental market. 48% of those ELI renter households are seniors or people with adults with disabilities. And we also know that there are stark racial disparities where Black, Latinx, and other BIPOC people are likely to be lower income and likely to be more rent burdened. And renters with high costs are likelier to forego medical care, nutrition, and other basic necessities. Oops, sorry about that. Let's see if we can go back. There we go. So what does that mean for older adult homelessness? Since 2017 to 2020, and we don't have the 2021 data in here yet, we have seen a 61% increase in the number of older adults, age 55 and older, who have accessed homeless services in California. And if you look at the age group of 65 plus, you can see that it has more than doubled. So while the numbers started small, we now have over 15,000 people who have needed homeless services as of 2020, and that only grew during the pandemic and beyond. So how does this relate to our master plan? The master plan has a goal in goal 5 of affording aging to prevent and end homelessness for older adults and people with disabilities. It's initiative number 117. And a group of coalition of groups came together to say, what can we do around making sure that there are effective homeless prevention policies in place? Because in many communities, people are being housed, but new people are becoming homeless for the first time in greater numbers than the number of people we're able to get into housing. So the solution is a targeted rental assistance, which is a subsidy to prevent or end homelessness. It would be a voucher that you could use to stay in the home you're in until an affordable unit becomes available or a federal subsidy becomes available. Or it could be to end homelessness, to get you housed with a subsidy. Who is it available for? You must meet all 4 of these criteria. You're either an adult with a disability or you are age 50 and older. You are acutely low income, which is 20% of area median income. So it's going to really the very lowest income renters. You are severely rent burdened, paying more than half of your income for rent, or if you're homeless, you would be if you were housed. And you meet one or more of the high risk factors, the predictive factors for becoming homeless that have been developed by the UCLA Policy Lab. And they are things like losing a spouse or partner, an illness or injury that prevents you from being able to work, coming out of an institution, and other high risk factors for housing precarity and homelessness. So where are we? We began this process last year and we got an author for AB 2547. Many of you were our coalition partners, so thank you. And that bill got a lot of love in the assembly. It was well received. People saw it as an important measure. While we get more affordable housing built, we have to do something to prevent homelessness among people who are very unstably housed. It passed through all the assembly committees, including appropriations, and it was sent to the Senate. And at the other side of things, not in the legislature, the master plan for aging has an impact committee, a stakeholder committee, and it had 2 top recommendations for the next period of focus. And they were to really address caregiving that works and to adopt a rental subsidy program. We did not get our $750 million that was going to be needed to fund this program into the budget. So we did not proceed to the Senate this year. There are plans to try again next year, whether through a bill or a budget ask or both. There may be new opportunities to tap into available federal funding that has increased flexibility. And there may be an opportunity, and that's why we are coming to you now as the Housing Subcommittee with a unified ask for us to coalesce around this recommendation at the day of action on September 20th. So here are the 5 co-sponsor groups, and we did have over 40 coalition partners who signed on as supporting this bill. And so we hope we can move it forward in the coming year. Happy to take questions. I see there's some information in the chat, and I will stop sharing. Liz Fuller says, I love this bill. Well, of course she does. It was her boss who was the author. Thank you, Liz. Assemblyman Nazarian was our author. And then after we went through the housing subcommittee, we were joined with Assembly Member Buffy Wicks as a joint author.
Patty, it looks like Jeff and Sherry have their hands up.
Thank you. Let's see. I don't know who was first, but Sherry, you're first on my screen.
Thank you. I think we'll both have an opportunity to ask questions or make comments. Thank you, Marty and Patty, for the excellent presentation. I was very appreciative and honored to be able to serve on the subcommittee with both of you, as well as the rest of the team members. I think I agree also with Jeannie, is that this is a critically important piece of potential legislation and to get funded. You know, we have a long range plan that we put into action in the state and in our local communities to build much more affordable, accessible housing over the next 10 to 15 years. And in the meantime, we are actually allowing many more people to become homeless because we're not keeping them from becoming homeless. And this gives us an opportunity to have basically a stopgap in place to keep people from sliding into homelessness while we hopefully work to generate and develop more housing opportunities that are affordable for our extremely low income older adults and adults with disabilities. I know firsthand my agency provides, for over 30 years, we have been a FEMA Emergency Food and Shelter Program grant recipient. And the first, 30 years of that time, we, were able to serve, maybe 15 to 20 families with a grant of around $20,000 or $25,000 to help them with rent stability in an emergency situation. Just in the last few years, and it continues to grow, this is not just a pandemic issue, although certainly the pandemic made it much worse, but it's continuing. We had an allocation this past year for our county to serve many more families with over $100,000. And we went through that amount of money in a matter of 3 months. I mean, that's how high the need is for people who need some rent stability and an emergency rent assistance. So this is such a hugely important bill. I was excited to see it being possible in the last legislation, but I would like to have us take this as the #1 priority for all of us, and next month, as well as for the rest of the year, in educating our legislators and the governor about the importance of this kind of intervention and this kind of action to help our lowest income residents. Thank you so much.
Thank you. Were there any other members of the housing subcommittee who wanted to weigh in?
Yeah, I had a question.
Great.
Go ahead. Okay. This is a great bill, and I totally applaud the priority. If you did receive what would amount to the funding level that you had hoped to get this year, how many people would you estimate that would be able to help?
That's a great question. Based on the 750 million, we would have spread it over 3 years, sort of with 1 year to ramp up and 3 years of actual programmatic rental assistance. And we were saying somewhere between 15 and 20,000 individuals, because it's often a very small subsidy. It's filling the gap between somebody's income of 30% of their income for rent and what their actual rent is. It may be, $400 or $500 a month, which is compared to how much we spend to try to get somebody housed once they enter homelessness, that's a screaming deal. It's also, of course, a much better policy.
Okay, thank you.
Any other questions?
Oh, Nina,
Yeah, just really quick question. We supported this and AB 2548. Stand ready to see what's coming in 2023. The slide that you just did, just highlighting the big pieces in the bill would be very helpful if we could get that, just so it's easier for us to explain to other staff and volunteers.
I'd be happy to put it in the DACLAC materials.
Thank you.
Thank you all. This has been great. And we will see you on the 20th. And hopefully we will elevate this initiative as really critical to the master plan for aging and advancing that goal.
hey, thanks, Patty. And Susan, I think we've, as part of this presentation, turning this over to Cody Ziegler, the Director of Statewide Policy, California Interagency Council on Homelessness. Is he here? I didn't see.
Hello. Actually, Cody wasn't able to make it, but I will be taking his place. I'm Giselle Sanchez. I am the Council Specialist for the CalICH, or the California Interagency Council on Homelessness. I'm going to go ahead and share my screen. I'll be going over the statewide strategic funding guide. All right, hope we could all see this. So this is the strategic uses for all the homelessness funding resources within the state. Something to note is this was released in November of 2020 when we were still the California Homeless Coordinating and Financing Council. Since 2022, we have changed to the CalICH and included 5 new departments into our council, including the Department of Aging. So we're very happy to have the director and to work with the department on supporting people, older adults who are experiencing homelessness, which is a significant population within people experiencing homelessness. So this is the funding guide that we had put together. It is really essentially to support the community level in figuring out what kind of resources are available in their community and how they could bridge these different funding sources and work together to fund a variety of different housing projects and homelessness interventions. So I will go ahead. Here's just the table of contents, the 4 different sections. One is just a crosswalk of all the programs available within the state. Overview of very detailed on the major programs within the state, and then just kind of a local investment plan, how local communities could use this funding plan into their own planning so they could arrange the resources however they need. And at the end, just a definition of all of the definitions of housing interventions that we have. So this is the first part of this. So this is just all the available resources within the state. So you'll see programs from HCD, our own from CalICH, listed here as HCFC, CDSS, and these are major state investments. We also on the next page have major federal investments. So the way that you would use this guide is if you need to look up a certain project that you're trying to fund, this will try to figure out which funding resource would be best to prioritize. So in our own cases, if you're looking at rental assistance and you're trying to figure out, we have the HAP program, the Encampment Resolution Funding Grant, which one would be better used to fund rental assistance? You would go for the housing, the HAP program, as opposed to the encampment program. It does this for all of the programs listed here. It also has it for the federal program. So there is a lot of questions on, there's so many different funding sources. How do we put them together? How do they work together? Where can different programs supplement gaps within the other programs? So this just lays out all the different possible options to use within this program. And then the next part goes into very detailed information on what these different programs are. So here's a brief overview. This is all the programs listed as well as where they're being funded. So counties, cities, and COCs. So a committee could look at this and see that both cities and counties are getting the same kind of funding. They could work together on trying to figure out what kind of programs to use and how they could use their funding together to support different programs. The next couple of pages go very in detail on specific programs. So we have the Home Key program up here. It is updated up to November 2021. We are planning on having one released for the fiscal budget that was just approved. So by the end of this year, this should be an updated version of this. But if you're looking for the most recent content or more recent information, there is always links to go to. So this is the Home Key program. It'll tell you the funding amounts and the constraints where this funding would not be eligible or something similar to that. Eligible activities, the status, and strategic guidance for local use. So the recommended uses and just details on how those could be used with other funding. And then again, it'll go do the same thing for the federal funding resources. So it is a very intimidating document because it goes through 39 pages of all information, but it is very helpful if you take a read through, trying to figure out where the different opportunities are. And then, so the next part is the local investment plans. These are examples of how local communities could use this into their own planning for their city, their county, their COC also. So this is an example of the different performance measures. Local communities often set goals for what they would like to see within their community. And these performance measures offer examples for what kind of goals those specific goals to what kind of investments they're looking for. It also offers the template, the blank version, so community could take this and really modify it for their own needs within that community. We also have a reference to our own statewide action plan for ending and preventing homelessness. So if any communities are looking for other ideas on what is happening around the state for different activities, this goes through a summary of what our action plan is. So the first action plan is just strengthening the system. A second is addressing equitably getting health, safety, and services to unsheltered people experiencing unsheltered homelessness. Third is expanding communities' capacity for sheltering and interim housing. Fourth is the expanding of access to permanent housing within communities. And then fifth is focusing on prevention. So those are the 5 different action areas we're having within our action plan. This action plan is currently being updated and it'll be presented at our own council meeting on September 1st. If you would like to have more information on this, please join us for our council meeting. We'd love to have you. And then finally is this 4th part on what does it mean to fund different kinds of projects and interventions. This will go through the different terms, so interim housing and non-congregate versus other interim housing programs. So just a rundown of all a variety of housing interventions and homelessness services. All right, and then also I would like to show you where you could find this information. So this is our Cal ICH webpage. If you go down to resources, it'll take you to the this putting together the funding pieces guide. We have a YouTube video, a recording of a presentation that goes very in depth into each part of this strategic funding guide. There's a link to the strategic funding guide, as well as an Excel version of those local community planning. And then also a link to all the state and federal and national resources that were presented within the guide. And then in our own webpage, if you'd like to get more updates from us, you're welcome to subscribe to us. This plan or this guide is being updated, so we will send out information on if there's a presentation and more updates on our council meetings. All right, so I will transition to questions if there's any questions.
Patty, do you want to?
I'm not seeing
in.
any hands raised.
All right.
Well, I will ask you one that doesn't relate to the funding, but we use the dashboard. We think it's very helpful to have a picture of what is happening with homelessness in the state of California. And one of the things I think that the DACLAC committee would be very interested in is to be able to look not just at age, but and disability, self-reported disability, but also to see those intersectional ways of looking at the data so that we can know not just who over the age of 65 is experiencing homelessness or asking for services, but what are the racial disparities? You can look at race and you can look at age, but you can't look at them intersectionally, and the same with disability. That would be a huge help in understanding who homelessness is really affecting.
Yeah, thank you. Thank you so much for your feedback. We're glad to know that communities use our resources and they're using them to make decisions within their own community. So we're really happy.
So if there aren't further questions, thank you so much, Gazelle, for this information and a lot of meat in this guide. And we know that there's further federal funds coming down. So we'll be interested to see those added into the mix. And we have some suggestions of how those can be used, including what you just heard about a rental assistance program, which is a key portion of homeless prevention. So thank you.
Thank you.
And I think we're ready to move to the transportation presentation of the transportation work group.
Okie dokie. Does that mean?
That is.
Woo! All right. Thank you, Patty. It's so cool to see you in a box after I've met you live and in the flesh. So which was really an unexpected, wonderful thing for those of you who have not met her. She is like 6 feet tall and just glorious in person. I mean, these boxes just don't do justice. Anyway, hi, everybody. I'm Debbie Toth with Choice and Aging. I am your subcommittee co-chair. I think I'm a co-chair. Maybe I'm the chair. I don't know. I get promoted every time I come to a DACLAC meeting. So it's fabulous. I'm now the chair. And we are going to, I'm not going to actually get into the presentation, Maria. I'm going to let John do this part of the presentation. What I would love to have is that one-page document that talked about our shared values. And Maria, you're the best. I wish you could be with me everywhere. Okay, so briefly, the transportation subcommittee spent a time with a small number of people saying, okay, now that they've given us this space, what are we going to do with it? And so we got together, we met with a facilitator and had a conversation about what it is that our shared values are, what are the dreams of our group, what are the fears of our group, and really how are we getting there to where our there is. So just briefly, I want to ground us in this, and then we're going to move on to a presentation from John Cunningham that compares how California is structured in terms of accessible transportation and comparing it to other places that might do it better than we do, which is shocking because California does everything the best, right? So Disability and Aging Community Living Advisory Committee, Transportation Subcommittee, ooh, shared values, dreams, and fears. Here we go. Agreed upon values: inclusion, equity, collaboration, action and follow through, sustainability, and candor. And I do want to explain candor really is that we can freely and openly talk about the brokenness without pointing fingers or having people feel responsible for a history of inaccessible transportation. We just want to be able to say it's broken and not you did this, but it's broken and we need to fix it. Dreams of the group. This subcommittee drives the internal work of political staff and legislators. That's a dreamy dream, right? There's participation and champions driving the work at all state agencies. Another wonderful dream. Tangible milestones are created and reached, not just created. Because of this work, this to me, this is the absolute key. Because of this work, everyone is able to get where they need to go when they want. The fear of the group is lack of integrity, like conversations don't lead to action. So we finally get Caltrans in the room. I'm just calling you out, Caltrans, because why not? And you're like, yes, we're in it. We're totally equity-based. We get that ageism and ableism are these really terrible things in the system and we're going to fix everything. And then they can't. Like there's a fear about that. Our other fear is that the status quo will continue to remain strong, which is what the history has been, as you know. We've presented on this before. We have more studies on accessible transportation that sit on shelves than probably any other topic. And I just want to say at this point, that whole presentation, I don't know if it was Giselle or Gazelle, I'm sorry if I'm pronouncing it wrong, I think it's Giselle, but I want that for transportation. I want to know what all the funding streams are. I want to know all those different bits and pieces and how we access them. Like we don't put the energy and effort into knowing all of these things in transportation. And yet if you can't get to and from the grocery store, or you can't get to and from medical appointments or your place of worship or to see your friends and family, housing doesn't mean much. So I just, there's no emphasis there. So how are we going to get there? I'm sorry, back on topic. Pathway. So how do we get to this place where everyone is able to get where they need to go when they want to get there? So the pathway is twofold. We've got one, education and partnership with state agencies. This is happening. I have to say, I am thrilled that we have Caltrans, CHP, the California Transportation Commission. We have all of these folks now coming to our transportation subcommittee meetings. So we have the department heads here in the full DACLAC, and we have these other folks now attending and interested and engaged. And it's a beautiful new day. So that's one, is educating. We're learning about them and how they do things, and they're learning about us and what our demands are. So that's the education. And the second piece, the second part of our pathway, is creating policy and budget reform legislation that will foster transportation systems change, incorporating truly accessible transportation in planning, investment, and implementation. So I do want to put a little asterisk here and say at our last transportation subcommittee meeting, which was yesterday, we agreed that we needed to come up with a definition for accessible transportation. So we're going to be doing some side work on coming up with what that definition is so that our work can kind of be universal. And we hope at the next full DACLAC to be able to present you with the legislation and budget ask that we want this body to push forward so that we can truly revolutionize systems change for accessible transportation in California. So now I will tell you, every reporter I talk to, every state person I talk to asks me, Debbie, how is accessible transportation done right? So John Cunningham's going to come on and do a little presentation now, looking at California compared to a few other states. John? I can't hear you. There he is.
Hello, can folks hear me?
Yes, welcome.
Great. Hello, everybody. My name is John Cunningham. I'm a transportation planner in Contra Costa County, which is in the East San Francisco Bay Area. I'm gonna give you this presentation, but I'm gonna provide a caveat at first. This is a work in progress. Only just started to put this together at the request of the DACLAC Transportation Subcommittee, as Debbie described in her introduction, in addition to other folks that have asked for this information. You know, who is doing it better? Okay, fine. If we aren't doing it well, who is doing it better? One thing that Debbie hasn't seen in the new version, I do have a slide, next slide, please, that defines accessible transportation. You know, we have launched into this presentation a few times, or different presentations, and we usually define it, and we sort of left that off as we've moved ahead, and so we're adding it back in, and it's an important piece to describe what we're talking about, but also what we're not talking about, and I'll get to that in a second. So accessible transportation is really talking about a wide range of services, a continuum of services, not a one size fits all service. And you see the bullet points there. We're talking about door-to-door transportation service, door-through-door transportation service, travel training, even food delivery really sort of fits in this spectrum. Volunteer driver programs, wayfinding systems, helping people get around areas they're not used to, and even it goes to advocacy, accessible transportation advocacy. And so that's what we're talking about when we say accessible transportation. And when I said at the outset of this slide, it's important what we're not talking about, and that is Americans with Disabilities Act paratransit service. And so that is a very specific type of service that is typically provided by public transit providers. It's a bit of an odd public service area and subculture, frankly. When the ADA paratransit regulations were adopted, it defined minimum standards, you know, very reasonably. And now over the approximately 3 decades since those standards, those regulations were passed, those minimums have sort of morphed into maximums in a lot of areas. And I'm generalizing. We're talking statewide, and some areas do it better. But generally speaking, if you talk to public transit folks, they stick to the ADA paratransit regulations, and they see them as maximums, not as minimums. It's if you're familiar with the saying, when a measure becomes a target, it ceases to be a good measure. That's sort of ADA paratransit defined. And so that is not what we're talking about here, that very rigid type of service. So next slide, please. And so why a comparison between states? Debbie touched on it a little bit in her introduction, but you know, I'll give you the broad strokes of the California model right now, and I'll get into it a bit more detail in a subsequent slide. But the California model is really limited. The existing statutes were passed in 1979, and frankly, they just aren't very impactful. At the time they were passed, it was acknowledged that this was a permissive program. It wasn't, you know, it was very limited in terms of funding and in terms of sort of requirements, compulsory actions. And then Debbie also touched on this. You see that in the second bullet point here. We've done 4 studies in 18 years in California on this specific topic area with 0 implementation. And that for most people, when they hear that, that's the phrase, you know, studies sit on shelves. Well, that's what we've done here in the accessible transportation service area. There are a number of different reasons why that's the case. I'm not going to get into them here. And then the other reason why we want to compare between states is, unlike other areas of the transportation system, accessible transportation, there really isn't a lot of standard approaches. The approaches vary by locality because these types of services are provided at sort of the very hyper local level. Local nonprofits, cities provide them. And so depending on the capacity of your locality, the approach is going to change. There's no sort of turnkey system, unlike other areas of the transportation system. And that's why we do need to look at other in other areas. So next slide, please. And so I'm going to cut to the chase with this on this slide, but then I'm going to get into the details and the whys in the next slide. Other areas that are more successful have better programs. There's two sort of defining components of those programs. One, it's the policies, and there are compulsory oversight and implementation structures. Again, California's system or non-system maybe is very permissive. It's an option for areas. Do you want to provide this service? Fine, here's a mechanism that's available to you. Again, I'll get into that mechanism in a subsequent, more detailed slide. And then funding. You need to have dedicated specific funding for these types of programs. And that's not just me saying this. You will see this in the subsequent slides. And there have been numerous studies that say you need funding to implement these programs. As I say that, it sounds a bit ridiculous because of course you need funding to implement programs. And I often try and draw analogies with other areas of the transportation system. You talk to somebody, talk to an engineer, can you build this bridge without any funding? You would get laughed out of the room. So it seems a bit ridiculous, but we're in the position here where we don't have dedicated funding for our programs. And so I do need to point that out. What I'm not discussing here is local funding. Again, that varies by jurisdiction. Some localities dedicate, local sales tax or general fund monies to their programs. We can't discuss that. There's too many variables. And we're also not talking about federal 5310 funding, which is available nationwide. And frankly, it's not a lot of money. California for the entire state gets $18 million a year. It's just, it's a pittance. So next slide. California. So I have 3 different slides. We'll talk about California, Oregon, and Florida. Start with a baseline here, what we have, and I've tried to make the headings consistent. So we have apples to apples. The program name, which again, really, it's a bit of a stretch to call this a program. It was a statute passed in 1979. And it's the Social Services Transportation Improvement Act. Now that, again, that act created a very specific mechanism. You see there in the last bullet, it's the Consolidated Transportation Services Agency mechanism. It doesn't have a lot of impact. It doesn't give you a lot of options in terms of sort of administrative strength. But it does make you eligible for what you see there in the middle under funding sources, this Transportation Development Act, Article 4.5 funding, and that's community transit services funding. Now, that funding is not dedicated to this type of service. It's also, transit agencies are eligible for this money. So right out of the gate, when we created this program in California, the funding, there was built-in competition for this funding. So there was a built-in sort of suppressing influence on creating these CTSAs is what they're called, because nobody wanted to share that piece of the pie. And public transit agencies are, well-established, politically powerful players, and this new mechanism really couldn't compete. So this 1979 Act just hasn't had a big positive effect throughout the state. There are some examples of successes, but again, I'm generalizing. It's just hasn't been that impactful. Next slide, please. And so we move to Oregon, which is a good comparison because they did have a special designation, much like California. Ours was the CTSA that I just mentioned. They created this program, the Special Transportation Fund, and that establishes consistently statewide these STF agencies that are eligible for funding. And they have oversight for these STF agencies. They're available statewide, and more importantly, they have dedicated funding to pay for these programs. You see there in the middle category, funding sources, and there's a variety of funding sources that go into the Special Transportation Fund. This is one of the areas where I'm I'm still compiling the information. You would think in this day and age of the internet that these funding amounts would be easy to find, but they are not. So I'm still tracking that down as time goes on. I'll populate this slide with the amount of funding that they have. And so that's the Oregon program. If you go to the next slide, please. And then the Florida program is very comprehensive. It's both in terms of funding, but also in terms of policy support. They have the policy, again, the last set of bullets there. The program is managed at the state level, as you can imagine. They have a statewide commission for transportation disadvantaged. We don't have such a commission in this state. And then there continues to be administrative and policy support trickled down to the local level. They have community transportation coordinators, and then they have a local coordinating board and just oversight for this program. And then again, importantly, very importantly, they have a dedicated funding source, and it's very well supported. You see the 4 bullets there in the middle of the slide. The vehicle registration fees go into this fund. It's even included as a normal part of the state transportation budget, which I guess I shouldn't find shocking, but I do. It's a part of, budgeting is a sort of it broadcasts your values, and it's in their budget. And then they also have capital programs and grant programs as well supporting this program. And so next slide, please. And we were also asked to take a look at international examples. This is definitely an area where my research is pending. And when I initially took a look at it, I started to look in Europe. They just have very robust transit programs. Unfortunately, most of the information that I found is they leverage their already robust rail and bus systems to provide incremental expansion for accessibility. We don't have that advantage here. Just financing and culturally, we don't have a robust public transit system here to leverage. And so I'm not sure how much information I'm going to get there, but at our meeting yesterday with the DACLAC Transportation Subcommittee, they gave me a lot of good input, some Asian examples that I just started to research, and even some more information is rolled in today via email, and I'll update this slide as time goes on. And that ends my presentation. I'd be happy to answer any questions, and I would love any feedback, particularly considering the almost semi-draft level of this presentation. I do want to make it more comprehensive. Thank you.
Thank you so much, John, for that wealth of information. This is actually the second time I've absorbed it, and each time I learn more. So I really appreciate this presentation. I want to make sure if there are any members of the Transportation Subcommittee who wanted to say anything or make a comment before we move on to now, how are we going to use this on September 20th? And I want to make sure we leave enough time for that as well. So if nobody has questions or comments, oh, I'm sorry, Kate, you have your hand up. For some reason, I'm not seeing hands on my screen.
Looks like we have a hand from Kate.
Yeah, I do. I'm sorry, I had to unmute myself. So this is absolutely fascinating. And as someone who tries very hard to take public transportation, it's very spotty, as you know, but I'm thinking also there are some promising practices in California, and I don't know how highlighted those are. A few years ago in Sacramento, the mayor of West Sacramento, I think, talked about a really innovative program that they were doing. And so I'm wondering how much there is here that we can tap into. And then completely on the other end of the spectrum, spent some time in Ireland a few years ago, and 65 and over and adults with disabilities ride free on all the transportation systems. And the part that I thought was really fabulous is they do a lot of training with the bus drivers and frontline transportation people. And that shows it just is, they're so welcoming, they're careful. So just a couple of points, but this is fabulous. Thank you so much.
Thank you, Kate. Good information. If I could make one comment, Kate's comments reminded me something else we have been talking about. West Sacramento success story. There are other success stories we can point to throughout the state, which is great. What we want to do is set up a system so it's not an anomaly that you have a successful program. We don't want to need a hero to have a successful program. We want it to be just systemic and implemented everywhere. But thank you for the heads up on West Sacramento. I'm gonna look at it.
This is Debbie. Can I just say that we're doing some, I think, some pretty impressive work, at least right now in Contra Costa County, and getting some local funding streams to fund implementation, not a plan, not a study, but actual implementation of the studies that we've been doing for 30 years in Contra Costa County. So I do want to echo that is possible. And I want anybody who's interested in this topic to please join our transportation subcommittee. There's no, like, you don't have to go through any jumping in process. You just show up. Amanda sends out the emails from the California Department of Aging, and anybody and everybody is welcome. We want to know about where it's being done well, but we need a system and a funded system that is reliable, that we can count on to be there for us for our funding every year, because we're fighting for that little tiny pile of money every year, and it needs to not be that way. We need to be able to think about people getting around inclusively, and we don't do that. We're not there yet, and we will get there. We are committed to getting there. So I would just encourage anybody who's interested in this topic to please join our transportation committee and learn, like we're all learning. And there's a great way to do this. And yes, we hope to have some policy to you at the next meeting. So thank you for the opportunity, everybody.
Great, thank you. And I think, Bill, you had a question or something you wanted to say? And Peter, I see you have your hand up.
Yes, and thank you. I'm off video because of a disability reason. Peter Mendoza, I did just want to encourage that we do need to, at some point, talk about paratransit. That's an important service to people with disabilities, people with intellectual and developmental disabilities, along with older adults. And it's just as important as fixed routes and other types of accessible transportation. And it serves a large portion of our community who cannot use fixed route or other accessible transportation due to a disability or health condition. So I would encourage that the conversation not stop here, that we talk about paratransit as well, because particularly as we talk about transportation as it relates to the master plan on aging, paratransit is an integral part of people who have disabilities and are aging in our community. So I just don't want that to get lost. Excellent presentation, and I look forward to hearing more.
Thank you, Peter. We're going to move to really figuring out how we use these three excellent presentations that we've had on September 20th, excuse me, and get an update from CDA on that. And Bill, we're holding your question. We're going to have a public comment period after we get that update. So is that Susan who's going to give us that update?
Hi, no, Patty, it's Amanda.
Yay. Hi, Amanda.
Hello, good afternoon, everyone. There has been a lot of excitement and enthusiasm around the September 20th Cal for All Ages and Abilities Day. Here is the homepage of our website. So I wanted to just spend a little time today talking about how registration is going and about next steps. And then Maria will actually walk us through the registration page in a second. And I'm going to go ahead and put it in the chat box. So planning is well underway. We don't have a final agenda to share with folks yet, but we have a good idea of how the day is going to go. And I can share that in a few moments. Go ahead and go to the next slide. I just want to talk a little bit about how registration is going. So we actually have 500 maybe possibly more at this time, people registered for the event, and it does have a maximum capacity. We do have limited space at the convention center. So I just want to encourage everyone to take advantage of that link right there in the chat box right now to go ahead and register. It's really simple, it just takes about a minute. And we want to make sure we have the most representation possible from this committee and all of our committees. Next slide, please. Here's a little breakdown of who has registered. So we have around 78% from who are identifying as general admission. These could be state partners, they could be members from advocacy organizations, they might be folks who previously served on a stakeholder committee and aren't currently serving on one of the committees. And then we have just 4% from our philanthropic partners, which is wonderful, and then 14% from our stakeholder members. Next slide, please. Exciting thing to note is that we have lots of out-of-state participation. We are going to see folks come in from a litany of states here and Washington, D.C. We've got folks from Colorado, Idaho, the Carolinas, Indiana, even Minnesota and North Dakota. So we have folks coming in who are supported by the California Center for Healthcare Strategies, and some of our philanthropic partners, the RISE Fellows. So we're going to be showcasing what we're doing here in California to folks from across the country. Next slide, please. Just wanted to briefly go over some of the agenda, what it looks like. We are going to have our breakfast meet and greet. That's when all of you are able to meet each other in person and perhaps mingle with the other committees as well. Then we're going to have welcoming and opening remarks from Director Demaris, which will be followed by our keynote to be provided by Ashton Applewhite. If you haven't seen her TED Talk yet, I recommend you check that out. I can try to find it and put it in the chat box in a second. She's an amazing speaker, very engaging. She's very funny. And then we will have your presentations. You will be setting the priorities for the next 2 years as you see fit for the master plan for aging. You will have about 10 minutes per committee to provide your platforms. Then we are going to have a conversation led by Marco Meach on a cross-sector partnership, how that really is the linchpin of advancing the master plan for aging. We will also hear from Joe Xavier, Director of the California Department of Rehabilitation, on how California is leading the way with all of these partnerships that we are building and growing across aging and disability. Next slide, please. Really excited, we're going to be having a video that has been developed by Inclusion Films, which will spotlight the lives of, well, at minimum 4 individuals. The film production team has been filming all over California, older adults, people with disabilities, and family caregivers, so that we can have a true perspective coming from their lens. And then we'll have a panel discussion with some of the folks who are featured in this film. We'll also have a conversation with state leaders facilitated by Kim McCoy-Wade. And then at the end, we'll talk a bit about, we'll have a table discussion and activity where people can report out what they feel like maybe the gaps were in the day, what they wanted to hear more about during the event, and want to ensure that it also is included in the public and stakeholder comments for input to the master plan for aging's next round of initiatives. And then we will hear from Maria Shriver, Chair of the Governor's Task Force on Alzheimer's Prevention and Preparedness and former First Lady. She will provide closing remarks and a call to action. So that is what our agenda looks like. Of course, there are also breaks and lunch built in. We will have box lunch, and that's one reason you have to register is to order your lunch. I see Marty's question. At this time, we are not able to offer remote participation. And of course, there is, for stakeholders, it's really important that we do have that in meeting time to see each other and meet each other in person and develop just do the final touches on your presentation, etc. So we will provide any updates if we are able to go offer a live stream closer to the date. How about Maria, could you go ahead and screen share the website and show folks how quick and easy it is to register? You're on mute.
I would be happy to take myself off of mute. Thank you. All right. So I just want to kind of do a little screen sharing of the Cal for All website. Here's our homepage. If you scroll down, it has a kind of a brief description. I do want to just draw attention to a couple of different tabs here. There are some instructions or some suggestions about lodging and travel near the Safe Credit Union Convention Center. I do want to flag that there's a small number of rooms that I believe are still available at the Sheraton Hotel at a discount rate. So if you need overnight accommodations, please be sure to snatch those up as soon as you can, as prices do tend to trickle upwards as we get closer to the conference date. I want to flag that there are travel stipends available for folks that meet the guidelines listed here. They're offered to individuals experiencing financial hardship, with preference given to California residents that are older or disabled adults, caregivers, as well as individuals residing in rural regions. The stipends are limited to $250 per individual, and there's sort of a 4-step process to be able to access those funds if needed. We also have a page that we've set up to talk about COVID-19 policy. We're asking all attendees to adhere to the most current COVID-19 public health guidance from the California Department of Public Health, as well as Sacramento County. And this page is subject to change, as COVID can be unpredictable. And so we're monitoring that closely, but you can go here to learn about what we're doing to keep folks safe and what some of the policies and procedures around COVID will be. Contact and support. If you want to email me directly, you can. If you want to use this page, it'll send me an email and then we can connect to answer any questions that you might have. And finally, just flagging the registration page for our committee members. Please be sure to register as a stakeholder committee member. So use this drop down and then complete the form. Some of the basic information being collected that I think you all are pretty used to: names, emails, phone numbers. We're asking for affiliation or organizations, titles, to select and check the committees that you're on. I know some folks are on more than one. Here's this really awesome selection for your lunch. Make sure to let us know what your preferences are. If you have any food allergies, if you have any accessibility needs, we're capturing all of that. And finally, just a couple of waivers that we're requiring folks to sign off on. One of them is focused on photography and videography, and the other is just acknowledging that that you may be exposed to COVID-19. There's always that risk when we gather in person. So that's really it, but I'm happy to answer any questions that folks have about Cal for All or the registration process.
Thank you, Maria. And as you said, folks can fill out the contact box to reach you if they have any issues with your registration not going through or not receiving a confirmation. We can get those to you. Also, just wanted to take a moment and thank the work groups who are advancing the recommendations to the MPA. We have Debbie and Eric leading the transportation recommendation group, and Lydia working on CalAIM, and Marty and Patty advancing the housing recommendations. I know it's a lot of work and we really appreciate it. And we will be scheduling a call with the leads from each of your groups to do a little planning on the presentation portion. So we'll have a little prep time with you before the day of. So we'll be reaching out to you about that. I'd like to give folks time to ask questions of me or perhaps of the work group leads about next steps with the recommendations that these work groups will be making.
And this is also a public comment time if people want to call in who are not members of the committee.
Bill Helter.
Can you hear me?
Yes.
I wanted to circle back to the comments on transportation if I could. A couple of quick comments. We all know that we're at the very beginning of the demand curve of the demographics as we go to 25% of the population being over the age of 50 in 2030. I think it's important to highlight that users of accessible transportation are not only individuals with chronic health conditions or disabilities as also their caregivers. And that demand is currently not being met. And so again, it's so important that we understand that there's a link between transportation and health, both for the healthcare services, but also for as an antidote to isolation. And I would end my points on the fact that CalAIM, one of the things that they're offering in the new improved services is looking at the social determinants of health, one of which is providing transportation to medical appointments if that individual does not have access to transportation. So again, recognizing the link between health and transportation, and the demand is not being met now. And lastly, it is only going to get larger going forward. Thank you for my time.
Thank you, Bill. Any other public comment? Well, I think we are narrowing down on 5 o'clock. We did it. And I really appreciate such a rich discussion and how we began talking about, you know, centering the person and a whole person approach. And I think each of the presentations sort of reminded us of the importance of that, and how when we're talking about whole person, we can't just use a white able-bodied person as our model, that we need to really meet people in a culturally humble way to address their service needs where they live and where they're at. And I think that the DACLAC committee has a great start on this, and we are going to see you all, we hope, on the 20th of September and really move these 3 priorities forward. So onward all. Thank you and stay safe, and hope to see you on the 20th.